What's going on, world? Welcome. Hey, so y'all already know what we're doing today. We are doing NCLEX questions. Welcome. You guys already know what we're doing today. We are doing NCLEX questions. Today is Friday, May 3rd. So you guys already know what's happening tomorrow. All right. Tomorrow's Star Wars Day. All right. Next week begins Nurses Week. All right. So shout out to everybody for joining. Hey, make sure you guys smash that like button. You guys share and make sure you guys, go over there and be a part of the community, meaning the Boot Nurse community. All right. Make sure you guys do all that. All right. Hey, I need 1,000 likes and I need 100 people up in here or we're not going nowhere. I got some questions for y'all. All right. Hey, but if you guys are just now joining, my name is Kevin. I go by the Boot Nurse. I am your local NCLEX coach helping y'all conquer the NCLEX. I've been a nurse for almost 4 years. I have worked ICU, OR, PACU. I was in the military for 16 years. I am also an award-winning author. My book will be coming out June 5th, so make sure you guys go check that out in the link tree. All right, you guys can pre-order that. And I'm here to give y'all NCLEX questions. So I want to know who you are, where you're from, and where you were at in your nursing journey. LaKara is taking her NCLEX tomorrow. Shout out to you. Hey, I don't recommend people being here to try to cram before they take their exam. But one thing I will tell you is that you are prepared, you are worthy, and you will get it done. So congratulations to you ahead of time. Come back Monday and let us know what's up. All right. Hey, but I need for y'all to smash that like button. I need for y'all to share it. I need for y'all to follow. Because if I don't got 1,000 likes and if I don't got 100 people up in here, apparently we're just going to sit here and have a conversation. Look here, it says, I know, don't kick me out, please. Look. I used to do that. I used to boot people and I would ban them. But somebody told me that I should be nice. So I got to be nice. You know what I'm saying? So shout out to all 54 of y'all. I want to know who you are, where you're from, where you're at in your nursing journey. Let me know. I said I need 1,000 likes. I need 100 people up in here or we're not going nowhere. We ain't going nowhere. All right. Get carpal tunnel for me. Make it happen. Hopefully everybody had a really good week. Shout out to everybody who is graduating this week. Shout out to all of y'all who are graduating this week. Y'all are one step closer to getting that NCLEX, taking that NCLEX and getting that license. So do not stop. You got to push through the finish line. All right. You got to push through the finish line. In the making, I start my ABSN on Monday. Shout out to you. Congratulations, Miss Barbara. Welcome. How are you? Shout out to all 130 y'all. Hey, we need 1,000 likes. Or we're not going nowhere. So I'm just saying, y'all can come over here and be greedy and take all this knowledge, but y'all can't give me no like. Like, what we doing, right? So like I said, hey, if you guys are just now joining, my name is Kevin. I've been a nurse for almost 4 years. I'm a registered nurse, BSN, if that really, really matters to you. Been one for 4 years, worked ICU, OR, and PACU. All right. And I was in the Navy for 16 years. Last 9 years of that, I was a military master instructor. Taught a whole bunch of stuff. So brought my talents down to TikTok. So what are we thinking? Kathleen says, graduate this month. Woo woo. That's what I'm talking about. Congratulations to you. And congratulations to everybody who is graduating. So I want to know who you are, where you're from, where you're at in your nursing journey. Y'all got to give me something. Give me something. All right. We can converse back and forth. I promise I won't cuss you out. As long as you're not mean and rude to me or anybody else in the chat. All right. What are we thinking? Hey, we're almost there. We're almost there to those likes. We're almost there. Almost at 1,000 likes. All right. Hey, make sure you guys share as well, because when you guys share, it puts it out to the For You page. And I need those people I need them to know that I'm here for them. You know what I'm saying? From California, got accepted to the nursing program. I started in August. Shout out to you. Is it Amez? I'm just going to call you Amez. So shout out to you. Here we go, ladies and gentlemen. Welcome. I got 135 of y'all up in here. We're about to do these questions, and here we go. All right, here we go. Question number 1. Shout out to Ohio. Here we go. Nurse EJ is assigned to the telephone triage. A client called who was stung by a honeybee and is asking for help. The client reports pain and localized swelling, but has no respiratory distress or other symptoms of anaphylactic shock. What is the appropriate initial action that the nurse should direct the client to perform? So what is the initial? What's the first thing that we should do? All right. What is the very first thing that we should do initially? All right. What do we think? Diamond is telling me C. Who else? is it Clary? It says, I have not started my nursing journey yet, but I'm graduating this Monday with my master's. Shout out to you. What are you getting your master's in? What are you getting your master's in? Now, remember, read the question, right? Also, look at the last portion of the stem of the question. What is the appropriate initial action that the nurse should direct the client to perform? Healthcare administration, shout out to you. Shout out to you. Hopefully you'll go out there and be better administrators than the terrible ones that are out here running hospitals. I said what I said. All right, here we go. Shout out to all 146 of y'all. We're doing NCLEX questions. Hey, by the way, I got these questions off nurseslabs.com. They are free sets of questions. You guys can go over there and check those out for yourself. All right, but here we go. Let's see what the answer is in 3, 2. And the answer is A. It's removing the stinger by scraping it. All right, well, let's see. Remember, when you guys are studying, you guys need to do your rationales, all right? This is by far the most important portion of your question when you're doing your questions, all right? Scrape the stinger will continue to release venom into the skin, all right? Removing the stinger should be the first action that the nurse should direct the client or direct to the client. Within the first few minutes after the stinger should be removed by scraping with a credit card rather than squeezing tweezers to avoid further venom exposure. All right, further venom exposure. I just took my NCLEX PM predictor for ATI. It's 95% good rating. I'm beating myself up. Mandy, I wish I could tell you. I've never done anything with ATI, but I hear that it is I hear it's pretty okay. But if you were with my my other homie, Nurse Amber, aka Nurse Glamber, she does not like ATI. But, you know, hey, ATI is in schools for a reason. So I think if you're over there scoring 95 and you did well in nursing school, I don't think that you're going to have a problem with your NCLEX at all. So be proud of that. Be proud of that 95 predictor, okay? Here we go. Question number 2. Nurse Anna is an experienced travel nurse who was recently employed and is assigned to the emergency unit. In her first week on the job, which of the following areas is the most appropriate assignment for her? Is it triage, ambulatory section, trauma team, or psychiatric care? What are we thinking? Hey, shout out to all 130 plus of y'all out here rocking. Today on this Friday, we're doing NCLEX questions. I got them off nurseslabs.com. They are free sets of questions. You guys can go over there and check those out for yourself. But I want to know who you are and where you're from and where you are at on your nursing journey. Where are you guys at? All right. You guys got to give me something. Give me something back. You know what I'm saying? I like to interact with the chat as much as I can. Okay. The ghost is screaming B at me. All right. I'm picking up what you're putting down. All right. What else are we thinking, y'all? I graduating BSN May 17th. Shout out to you. Is it Toro, Buffalo, New York? Shout out to Canada, because that's where you're from. Triage will be too much for her. Okay, then what's the answer then? What's the answer be? All right, LVN waiting for my eligibility for NCLEX. Shout out to you. Is it Raj K? I'm in a master's program for nursing, 2 more semesters. Shout out to you, Lolo. I'm in a master's program too for nursing education. So shout out to you. I got you. About to start my RN program in August. Brianna. Okay, girl, I see you. All right, let's see what the answer is, y'all. Let us see what the answer is in 3, 2. And the answer is B. It's ambulatory section. It is an ambulatory section. I couldn't even read that one. She is experienced. I don't think it will be too much. All right. But she may be experienced, but she's new. So think about that. All right. The ambulatory section deals with clients with relatively stable conditions. All right. The decision of whether or not to delegate or assign is based upon the RN's judgment concerning the condition of the patient, the competence of all members of the nursing team, and the degree of the supervision that will be required of the RN if the task is delegated. Now, not saying that anything about her not being able to do it. It's about the fact that she's new there. So, whoa, who came in here and said something? Somebody came in here and said something. Congratulations to who? Did I miss it? What did I miss? Congratulations to Crab Cakes. I don't even know who that is. Anyways, so wait, Crab Cakes, what happened? What did you say? I didn't see it. Here, I'm going to go to the next question so y'all can do that. I didn't see it. Oh, I graduate nursing school today. Oh, congratulations. Congratulations, Crab Cakes. Hey, y'all give Crab Cakes all the love. You know what I'm saying? Congratulations. Here we go. Question number 3. A client arrives at the emergency department who suffered multiple injuries from a head-on car collision. Which of the following assessment should be the highest priority to take? All right. So out of all these things, what is the most important? Think about it. All right. Think about our ABCs, right? Think about our level of consciousness. All right. So Is it unequal pupils, irregular pulse, ecchymosis in the flank area, or a deviated trachea? What are we thinking? Hey, shout out to everybody that's out here rocking. We're doing NCLEX questions. I got them off nurseslabs.com. They are free sets of questions. You guys can go over there and check those out for yourself. Make sure you guys like, share, and follow. Hey, we're on the road to 10,000 likes. My man, E-Money in the building, y'all. If I don't have 10,000 likes by the time I had to question 10, my throat hurts, and I guess y'all don't get no more questions. So it would behoove you to get carpal tunnel from me right now. Make it happen. All right. If you guys are just now new, my name is Kevin. I've been a nurse for almost 4 years. I worked ICU, OR, and PACU as well. I was in the Navy for, wow, really, Miss G coming over here with the nonsense already. Lord have mercy. I was in the Navy for 16 years. 9 of those 16 years, I was a master instructor. So, hey, bringing those talents over here because I love teaching y'all. So shout out to y'all. Texas, 2 semesters left. Shout out to you, Steph. I'm also in Texas. I live in San Antonio. So shout out to all my Texas folks and all my San Antonio folks. Miss G, thank you for the heart me. I appreciate you, as always. All right, y'all, let's see what the answer is. Let us see what the answer is in 3, 2. And the answer is indeed a deviated trachea. All right, a deviated trachea is a symptom of a tension pneumothorax, which will result in respiratory distress if left untreated. The first question of the ESI triage algorithm for triage nurses asks whether the patient requires immediate life-saving interventions or simply is the patient dying. The nurse determines this by looking to see if the patient has a patent airway, if the patient is breathing, and does the patient have a pulse. All right. Hey, airway, breathing, circulation, but also remember level of consciousness. Your level of consciousness will tell you if your patient is having an ABC issue. They all go hand in hand. So shout out to all of y'all that got that question correct. As a matter of fact, I don't know what this is. Let's go ahead and move this over here because, all right, let's see. Here we go. All right, there we go. Question number 4. Question number 4, Nurse Kelly, a triage nurse, encounters a client who complained of mid-sternal chest pain, dizziness, and diaphoresis. All right. Recognize the cues. You have to recognize the cues. Which of the following nursing actions should take priority? Is it administer oxygen therapy via nasal cannula, notify the provider, complete history taken, or put the client on an EKG monitor or ECG monitor? What are we thinking? What are we thinking? Now think about this. They have mid-sternal chest pain. All right. They have mid-sternal chest pain. They have dizziness. They have diaphoresis. So what is the priority? What is the priority? Everybody's screaming D at me. Okay. Everybody's screaming. Hey, if you guys are just now joining, we are doing NCLEX questions. I got them off nurseslabs.com. I want to know who you are, where you're from, where you're at in your nursing journey. By the way, A and then D. Who said that? Marissa said A and then D. Okay, cool. Cool. Jessica, ECG, right? I don't know, Keanu. You tell me, guy. You tell me. Well, we got to figure it out here in a second, though. All right, you're in your last semester. Shout out to you, Lulu. A and then D. Okay. All right, remember, the key word is priority. My patient is having mid-sternal chest pain and they're having dizziness and diaphoresis. All right. So my patient is not doing so hot. So what do I want to do first? What do I want to do first? All right, let's see. Here's our answer in 3, 2, and 1. And the answer is to administer oxygen therapy via the nasal cannula. So the priority goal is to increase myocardial oxygenation because the patient is giving telltale signs of a myocardial infarction. All right. Place the client on a cardiac monitor and establish IV, give the chewable aspirin, clopidogrel, ticagrelor, control pain, and consider O2 therapy. All right. A lot of people are going to sit here and be like, hey, MONA but MONA is just the acronym to remember when it comes to a patient who is having a myocardial infarction. All right. Shout out to you, Jess. All right. Shout out to you, Brandy. You knew it. That's what I'm talking about. Hey, remember, ladies and gentlemen, remember, as you guys are studying this, all right, you got to read your rationales. Your rationales help solidify what you are learning. All right. Nikki, shout out to you for getting it. Hey, and if you didn't get it right, that's okay. I'd rather you get it wrong here than get it wrong somewhere else, especially when you're taking your exam. So circle back, get the content, keep it pushing. All right, here we go. Question number 5. A group of people arrived at the emergency unit by a private car with complaints of periorbital swelling, cough, and tightness in the throat. There is a strong odor, There's a strong odor coming from their clothes. Damn it. They report exposure to a gas bomb that was set off in the house. What is the priority action? What is the priority action? Does Mona, hold on, Steph, I know, right? It says, does Mona is the order to go or just to memorize the actions? It is to memorize the actions. All right. Because if you go off of Mona, it's telling you to give morphine before you would give oxygen. And that's not necessarily, that's not true. All right. Now, if the question in the stem of the question, it says oxygen's already provided, what would you do next? Then, of course, I would want to do morphine, right? Or it depends on whatever is being asked to me inside of the question. So based off of this question specifically, what is the priority action? Instruct personnel to don personal protective equipment, direct the client to the cold or clean zone for immediate treatment, immediately remove other clients and visitors from the area, measure vital signs and auscultate lung sounds, or direct the client to a decontamination area. All right. What are we thinking? Everybody's telling me A, I got E, I got some C's. Hey, if you guys are just now joining, we're doing NCLEX questions. I got them off nurseslabs.com. They are free sets of questions. Thebootnurse.com/special is my website. I have an NCLEX course. Right now it's 70% off. You can get it for $97. So you guys can go over there and you guys can check that out for yourself. All right. But I want to know who you are and where you're from and where you are at in your nursing journey. All right. Where are you? What is W? Toro. That letter ain't even on here. What are we doing? All right, y'all. Let us see. Let us see what the answer is in 3, 2, and the answer is E, not W, but E. Ohio 6th term. I just wanted to 10-year life. Whoa, hold on. Lovely R says, hey, I attended a few of your lives. Just wanted to say thank you. I passed NCLEX RN. That's what I'm talking about. Who is that? Lovely R. I'm going to pin you right there. Ladies and gentlemen, right now, I want you guys to give this young lady all of her flowers. Congratulations on passing the NCLEX. Welcome to the greatest shit show on earth, known as being a nurse. If there's a piece of advice that you could give to everybody out here taking their NCLEX, man, what would it be? And once again, congratulations to you. Ladies and gentlemen, real quick, I got some test taking tips. You guys can go over there and check out. They're tips to help you conquer the NCLEX, and it's a free download. You can check it out there at bootnurse.com/test. That's 42 pages. That's an ebook that I created that I'm giving y'all for free. So if you don't have it, I recommend you go over there and you get it and you be a part of that. Why? Because I like giving you knowledge. So go over there and check that out, thebootnurse.com/test, or you can find it in the link tree. You guys can find it over there as well. All right. So here we go. Question number 6. When an unexpected death occurs in the emergency department, which task is the most appropriate to delegate to a nursing assistant, aka the UAP, or unlicensed assistive personnel? All right. Is it assisting with postmortem care? Is it appropriate to delegate to the UAP to facilitate meetings between the family and the organ donor specialist? Is it appropriate for a nursing assistant to escort the family to a place of privacy? Is it appropriate for the nursing assistant to help the family to collect belongings? What are we thinking? A lot of times when you read the questions like that, you'll be like, I don't know. Can they do that? Now, this is essentially a management of care question, right? Delegation, supervision, an assignment. So I, as the RN, need to know who can do what. It says my CNAs always do postmortem care while I do all the other stuff. Facts. That's what they do. However, there are a lot of things that happen in the real world that are not supposed to happen, that don't happen on NCLEX world. Remember, NCLEX world is perfect. There's things that you do out here, CNAs or LPNs or whatever, that you don't do on a national perfect world exam. Okay, so you have to remember that. You have to remember that. All right, here we go. Here's our answer in 3, 2, and the answer is A, assisting with post-mortem care. It says true, NCLEX world is perfect, but real nursing is so different. Very much so. Very much so. D, waiting to take that NCLEX? Well, I'm glad that you're here. Make sure you smash that like button and you become a part of the team. All right. Postmortem care requires some tuning, cleaning, or turning, cleaning, lifting, and so on. And the nursing assistant is able to assist with these duties. The use of a nursing assistant increasingly demands registered nurses to delegate patient care tasks according to the principles of the ANA. All right. So that is the answer. Can UAPs do that? Yes. It says clue word assisting. Correct. It says, give guess what? It says, give guess what I passed my exam. What'd you say? Say that again? Ma'am, did you just say that you passed your NCLEX exam? I want to make sure I understood that correctly. I want to make sure, is it ILO? I want to make sure I understood you correctly. Tell me, I want you to say that again. I want to make sure everybody heard it. But hey, the key word is assisting. The key word is assisting. I just registered to take the LPN exam. Shout out to you. Is it Naja? Naja. Shout out to you. All right, here we go. Question number 7. I'm trying to say, Kevin, I passed my exam. Yes, that's what I'm talking about. Yes, Lord. Hold on. Hey, if y'all don't know who ILO is, ILO has been a frequent flyer, right? Coming to the lives all the time, jumped on a whole bunch of stuff. Welcome to the greatest shit show on earth, known as being a nurse. If there's a piece of advice that you could give to everybody out here, what would it be? And once again, congratulations to you. Y'all give ILO all their love and all the support and all the flowers. I love to see it. All right, here we go. Question number 7. The physician has ordered cooling measures for a child with a fever who is likely to be discharged when the temperature comes down. Which task will be appropriate to delegate to the nursing assistant? All right, so can the nursing assistant prepare and administer a tepid sponge bath? Can they explain the need for giving cool fluids? Can they assist the child in removing outer clothing? Or can they advise the parents of the use of acetaminophen instead of aspirin? What are we thinking? C for sure. Okay. Got some C's. We got some C's. Hey, shout out to all 270 y'all. We're doing NCLEX questions today on this Friday. Y'all could have been anywhere else, but you're here with me, and I appreciate that. Make sure you guys like the live. We're on the way, on the road to 20,000 likes. All right. Hey, make sure you guys share. The shares and the likes are important because it gets it out to the people that need it. All right. So I appreciate the follows. Is it pow, 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 pow? I'm sorry. But appreciate all the follows. But what do we think it is, y'all? What do we think the answer is? Pow, 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 pow. All right. Y'all see what Sexy Red done did to me? Here we go. Rosa, thank you for the roses. I appreciate you. All right, here we go. Let's see what the answer is, y'all. Let us see what the answer is in 3, 2. It says, no, Lex says no. D, you can't advise parents. Okay, well, let's see in 3, 2. And the answer is C. It's C. Assist the child in removing outer clothing. The nursing assistant can help with the removal of outer clothing, which allows the heat to dissipate from the child's skin. Hold on. It says, I would say study hard and join the live all the time and follow Kevin. You guys got this. I love to see it. I appreciate you for that. I appreciate you for that. All right. The client is the center of care. The needs of the client must be completely met with the knowledge, skills, and ability of the staff to meet these needs. All right. So can the UAP assist? Absolutely. They surely can assist. 100%. All right. 100%. So shout out to y'all for getting that right. Remember, management of care, delegation, supervision, management, assignment. That's what the RNs do. You need to know what everybody can do. All right. LPNs, you need to know what you can and can't do and what you can and can't accept. All right. It says, don't get distracted. Look at what the question is really asking. Exactly. RTFQ. Who can tell me what RTFQ means down in the chat? For all my frequent people, let me know. Question number 8. You are preparing a child for IV conscious sedation before the repair of a facial laceration. All right. What information should you report immediately? Meaning right now, to the physician. All right. Is it important to report that the child suddenly pulled out the IV? Is it important to report that the parent is not sure regarding the child's tetanus immunization status? Is it important to report that the parents want information about the IV sedation? Or is it important that the parents' refusal to administer the IV sedation? What are we thinking? Anybody that is a parent in here, sometimes you can use common knowledge. Sometimes you can use common knowledge. The whole scope of it is we're talking about what is in the best interest of the patient. Remember, the patient is the child. The patient is the child. All right. So what can keep my patient safe? All right. What can keep my patient safe? Shout out to all 270 y'all. We're doing NCLEX questions. Got them off nurseslabs.com. My name is Kevin. I've been a nurse for almost 4 years. I worked ICU, OR, and PACU, as well as I failed my NCLEX 3 times. I failed my NCLEX 3 times and I passed on the 4th. I said that really slow for those individuals that said, wait, what did you say? I failed 3 times. Shocking, right? No, not really. But let me tell you something right now. Don't nobody care about how you feel about your exam. Don't nobody care that you failed. Your job will never ask you. Your job will never ask you. Your patient will never ask you. However, what you need to do is that you need to gain your nursing competency. You need to gain your nursing competency because this exam talks about nurse safety. And if you don't get your mindset right for nurse safety, you will never pass this exam. So you have to get it together. You have to get out of your own way and you have to push. Yes, Rose, really. I really out here just told y'all that I failed my NCLEX 3 times. And I really don't care what anybody has to say to me about me doing me. All right, because I've been a nurse for 4 years and not once have I made any issues taking care of my patients. So if you want to be a RN or an LPN for whatever NCLEX that you're taking, get out of your own way and realize that you need to be a safe and confident nurse. You see what I'm saying? Safe, confident, and competent. Make it happen. So our answer is D, the parent's refusal of the administration of the IV sedation. The refusal of the parents is an absolute contraindication. Therefore, the physician must be notified. But the autonomy of parents is very obviously different from the autonomy of patients who are to make decisions for themselves. Remember, children can't make decisions for themselves. All right. While adult patients are generally thought to have an absolute right to refuse medical treatment for themselves, we don't usually think that parents can refuse all medical treatment for their children. Hey, believe it or not, you can't. You can't refuse when it comes to certain things for children. You cannot. All right. It says I'm new here. What's the acronym that you mentioned above? Listen, RTFQ. Y'all let them know. RTFQ, safety, confident, and competent. Got it. Love it. Amen. Winning is winning, whether it's an inch or a mile. That's what I'm talking about. Not the Vin Dieselist family up in here. So shout out to everybody. Listen, hey, all my new people that are about to go take the NCLEX for the first time. Hey, listen, you got this. You got this. Trust and believe me. For all my repeat test takers, you got this. All right. Question number 9. The emergency medical service has transported a client with severe chest pain. As the client is being transferred to the emergency stretcher, you note unresponsiveness, cessation of breathing, meaning breathing has stopped, and an unpalpable pulse, meaning you have no pulse. All right. Which of the following tasks is appropriate to delegate to the UAP? All right. Can the UAP assist with intubation? Can the UAP place the defibrillator pads? Can the UAP do chest compressions? Can the UAP initiate back valve mask ventilation? What is the answer? Hey, stop playing games with me right now. I need for y'all to share this live. And stop playing games with me, all right? Stop being stingy. Stop being selfish. There's enough of me to go around. Pause. You know what I'm talking about, all right? Give me the 20,000 likes and stop playing games, all right? If you guys are new here, welcome. This is how we do. All right? Welcome. I want to know who you are, where you're from, and where you were at in your nursing journey. I passed my NCLEX. Thank you so much. Pause. All right, I'm about to listen. Okay. I love it. You are number 3. Welcome to the greatest shit show on earth, known as being a nurse. And I'm saying this when Nurses Week is coming up, right? If there's a piece of advice that you could give to anybody out here or everybody out here, what would it be? And once again, congratulations to you. Hey, everybody needs to give KKGH all the love. All the love right now. All right. All the love right now. Shout out to Indianapolis. Take my NCLEX on the 15th. Shout out to you, Chris. Is it Marifer 03? I'm taking it for the 4th time. And guess what? You're going to conquer it on your 4th time. Can I get an amen? Yes, Lord. Here we go. And the answer is C. It says, what does it say? It says, do you have a schedule for the live? So my live is, you should see it. It's Monday, Wednesday, Friday at 5:30. All right. And so the answer is definitely C. It's doing chest compressions. All right. Performing chest compressions are within the training of the nursing assistant. Every good certified nursing assistant should be proficient at CPR. Basic life support certification is widely used terms for any form of CPR certification and is required for all registered nurses and LPNs, as well as UAPs, patient care techs, so on and so forth. All right. Hey, you need to know that. I graduate May 9th from LPN to RN. Oh, so you're in the bridge program. Shout out to you. Is it Alicia? Shout out to you, Alicia, for doing the damn thing. I love to see it. Here we go. Question number 10. The nursing manager decides to form a committee to address the issues of violence against emergency department personnel. Hey, listen, you tell a patient that come in there, hey, they can get either left or right, or they can get both. And I'm talking about them hands if they test you. I'm just playing. Don't be fighting people. All right. Which combination of employees would be best suited to fulfill this assignment? All right. What would be best? Is it the ED physician and charge nurse? Is it the LPN, RN, and the nursing assistant? Is it experienced nurses or RNs and paramedic, or at least one representative from each group of the emergency room department? What do we think? Got some people saying D. It says fight and get you fired. Been there, done that. Listen, maybe let me stop. I'm not gonna say it. Yes, you said my name correctly. All right, Alicia, I got you. Hey, listen, I ain't trying to tell you I'll be out there fighting nobody. You know what I'm saying? But do not, and I repeat, do not be anybody's punching bag out here. I'm telling you, my new nurses, do not allow anybody to beat up on you ever. Because I'm telling you right now, the only thing a hospital is going to say to you is, what could you have done better? And I'm telling you right now, these hospitals don't give a shit about you when it comes to that. All right. But I'm telling you right now, you better not let nobody put hands on you like that. Ever, 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 ever. You always protect yourself. What's up, Samantha? Always protect yourself. You only got one you. And trust me, these hospitals ain't got no problem replacing you. Trust and believe me. All right. Let's see what this answer is. Here's our answer in 3, 2. And the answer is D. D. At least one representative from each group for personnel. It says, what do you suggest if a patient does put hands on you? Protect yourself. Period. And then if they decide that they want to put it, you need to protect yourself. Get away from it and then press charges. I don't give a damn what any hospital tells you. Press charges. Hey, in the chat, while you guys are following and liking, you get away. And I need for all y'all to say press charges. I don't care if they're drunk. No. No. All that violence nonsense stops here. You protect you, number one, in the chat. Right now, put press charges. Press charges. I want to see everybody put it right now. At least one representative for each group of ED personnel should be included because all employees are potential targets for violence in the ED. The diversity of the group should be considered and assure that each department or each employee is represented. Listen, y'all better stop playing with me. Y'all don't listen. Do not let these people run all over you and tell you that you cannot press charges. Now it's a felony. Like now, I think it is a felony. It's a felony misdemeanor or something along the lines of that. Because I'm telling you right now, we do not let people, you ain't gonna let nobody come up in your house and put hands on you. You ain't gonna let nobody come up in your house and put hands on you. Now, if you have a patient in a nursing home who has Alzheimer's or dementia, we're drawing a fine line. But if you have somebody that you're trying to take care of in the emergency department who is putting hands on you because they're drunk or they're on drugs or something, no, absolutely not. Ladies and gentlemen, I have a book coming out. I'm an award-winning author. It says it. Whether you want to believe it or not, I am an award-winning author. It's called Conquer It, The Journey to Passing the NCLEX. This book is coming out June 5th, and you can pre-order it right now at that website. Trust and believe me, I'm telling you, as somebody who failed their exam 3 times, whether you're taking it for the first time or you're taking it for the 10th or 12th time, I know the feeling of what it is to go through this exam. Hey, come be a part of the journey. All right. And let this book guide you to something better when it comes to passing this exam. You can check it out at thebootnurse.com/books. Go over there and get it. Stop playing games with me. All right. Here we go. Question number 11. All right. A client suffered an amputation of the first and second digit in a chainsaw accident. All right. Got to understand what the digits are. Our digits are our fingers, right? Which task should be delegated to the LPN? All right. So can the LPN cleanse the amputated digit and place them directly into ice slurry? Can they wrap the cleansed digit in sodium moist gauze, sealing it in a plastic container and placing it in icy water? Can they gently cleanse the amputated digits and the hand using providone iodine? Or can they cleanse the digit with sterile normal saline and place it in a sterile cup with sterile normal saline? What are we thinking? Shout out to all 200 plus of y'all. We are doing NCLEX questions. I got them off nurseslabs.com. They are free sets of questions. You guys can go over there and check those out for yourself. Also, make sure you guys share. All right. That is the trifecta that TikTok needs for me to get out there to the For You page. Also, make sure you guys follow. Come be a part of the team. I drop some type of video every day. One young lady that I coached over the month of April just took her NCLEX 2 days ago and passed on her 4th attempt, y'all. On her 4th attempt. All right. You are delayed out here. You are never denied, ever. All right. Get out of your own way. Here we go. Here's our answer in 3, 2. The answer is B. Wrap that thing. I'm sorry, wrapping the cleansed digit in saline moist gauze, sealing it in plastic container and placing it in icy water. That's what you want to do. I forgot where I was for a second. Once a finger amputation has occurred, ischemic tolerance times are 12 hours if warm and up to 24 hours if cold. For more proximal amputations, these times are halved. The amputated part should be covered in a normal saline soaked gauze, sealed in a plastic bag, and submerged in icy water that does not, or with no direct contact with ice. If there is direct contact with ice, it can result in tissue damage and render the amputated part non-viable, right? Who said that? Master Nail Rosa? Oh, yes, ma'am. That's how we do that. So remember, you need content, you need your questions, you need your rationales, okay? So make sure you guys are understanding that. Circle back if you got this wrong. Shout out to you, Paula. That's what I'm talking about. Here we go. Question number 12. The client arrives in the emergency unit and reports that a concentrated household cleaner was splashed in both eyes. All right. Which of the following nursing actions is a priority? So what is the priority? What is the very first thing that I want to do? All right. What is the very first thing that I want to do if I get chemicals splashed in somebody's eye? Examine the client's visual acuity, eye patch. All right. Is it use allergen drops in the eyes or flush the eyes repeatedly using normal saline solution? What are we thinking? What are we thinking? Shout out to all 200 of y'all rocking D. Duh. Stop it. Stop. Hey, you got to remember, some people don't know. Some people don't know. We got to meet people where they are. And some people don't know this. All right. And honestly, some nurses forget this. You know, some nurses forget this. So we got to meet people where they are. We got to meet you where you are. All right. As an educator, that's what you learn. You got to meet people where they are. Not everybody's going to meet that specific standard depending on where they are. I graduated on 11, take the NCLEX at the end of this month. Shout out to you, Beth. Wow, I said A, unbelievable. It is very much believable. Here we go. Here's our answer in 3, 2. Mandy says, I'm taking May 15th for the first time after I graduated May 21. Mandy, that's what I love to hear. I love to hear it. Congratulations to you for never giving up. Always push to turn that dream into a reality. All right. The answer choice is D. Flush the eyes repeatedly using sterile normal saline. Okay. Sterile normal saline. All right. Initial emergency action during a chemical splash to the eyes include immediate continuous irrigation of the affected eye with normal saline. Immediate irrigation with copious amounts of isotonic solution, as described previously, is the mainstay of treatment for chemical burns. Never use any substance to neutralize chemical exposure, as the exothermic reaction can lead to secondary thermal injuries. Okay, so shout out to y'all who got this right. I appreciate all the follows. Who's that? Shay Baby, D Redmond, B Mom Brun, y'all know what I'm talking about. I appreciate y'all for following. All right. Make sure if you haven't followed, y'all drop a follow. All right. Because your boy out here trying to make it. You know what I'm saying? I'm trying to make it. All right. Here we go. Question number 13. All right. A 5-year-old, paint the picture. A 5-year-old was admitted to the emergency department due to the ingestion of an unknown amount of chewable vitamins for children at an unknown time. Upon assessment, the child is alert with no symptoms. Which of the following information should be reported to the physician immediately, right? Now, think about this. They probably chewed up some Flintstone vitamins, all right? So what is something about vitamins that is important that we need to talk about to the doctor, all right? Is it important that the child was nauseated and vomited once at home, that the child had been treated several times for toxic substance ingestion, the vitamin was ingested contains iron, or that the child had been treated multiple times for injuries caused by accidents? What are we thinking? What are we thinking? Everybody screaming C at me. Everybody screaming C. All right. Daisy saying C. Lexi saying C. Who else? Gengin. Is it Gingin or Gengin? Gengin? It doesn't matter. Shout out to y'all. All right, here we go. That urn. Hey, if you're from Baltimore, it's urn. So you are in. Oh my God. All right, I'm done. I don't need nobody from Baltimore coming for me. All right, here we go. Here's our answer. The answer is C. The vitamin that was ingested contains iron. Oh What courses you guys recommend to study for NCLEX? Karina, I actually have an NCLEX course. You can check it out. It's actually linked in my bio. It's thebootnurse.com/special. I have a 70% off right now where you can get my course for $97 and you have it for a lifetime. And then, for however long your life lasts, you can have it. But iron is a toxic substance that can lead to massive hemorrhage, shock, coma, and kidney failure. Iron poisoning is one of the most common toxic ingestion and one of the most deadly among children. Failure to diagnose and treat iron poisoning can be serious consequences, including multi-organ failure and death. Yes, Rosa, yes, they can be bad out here. Don't be giving these babies all these Flintstone vitamins. It don't matter how good they taste. All right? Because I'm a Flintstone kid. All right, here we go. Question number 14. All right, question number 14. The following clients come to the emergency department complaining of acute abdominal pain. Now, prioritize them. All right, I want you to you're going to use every single one of them and you're going to put them in order. So in what order would this be of severity? So who needs to be seen first to who needs to be seen last? It says, I work in dialysis. We watch out for iron overload due to kidneys not functioning. Absolutely. Just like you look out for those, since our kidneys aren't working, everything is going to be high. What else is going to be high? Specifically, that potassium is going to be super high, right? So that's what you guys got to realize. With kidney failure, one of the biggest things that we look out for is that potassium being high, right? Because the body's not able to filter it out, right? Body's not able to filter it out. Sodium as well. Yup. Yes, Lord. Shout out to all 220 of y'all. We're doing NCLEX questions. We are on the road to 30,000 likes. The big 30 with the K. All right. Make sure you guys smash that like button. You guys share and you guys follow. That is the trifecta to get out to the For You page. I want to know who you are, where you're from, and where you're at in your nursing journey. Let us know down in the chat. Heather's telling me 4 and 3. You got to use them all. You have to use them all. Samantha saying 4, 1, 2, and 3. The tearing pain is more severe than the right lower abdomen. So you got to use them all. You got to tell me in which order it would be. 4, 2, 3, 1, and 5. Okay. I'm not in nursing, but I would like to be. Amy, I'm glad that you're here. Hey, there's one good lady that you can follow, and it is Nurse Larissa. You can go over there. You can follow her. But hey, if you want to be a nurse, welcome, welcome, welcome. All right. It says a dialysis technician I have currently. Shout out to you, Jen. All right, y'all. Let us see. Let us see what the answer is. Let us see what the answer is in 3, 2. So the answer would be A, D, B, C, and E. All right, now let's read them out first. So the client with a pulsating mass has an abdominal aneurysm that may rupture and he may decompensate easily. So an abdominal aortic aneurysm is a life-threatening condition that requires monitoring or treatment depending upon the size of the aneurysm. All right, the woman with the left lower is having an ectopic pregnancy. It says graduate my RN in 7 days. Shout out to you, Katie. Shout out to you. Question 15. Number 3 would be the kid who have appendicitis, right? Because he has the acute abdominal pain without having a prior appendectomy. All right, the woman who is vomiting shows gallbladder problems, right? And then lastly, it would be the mid-epigastric pain is suffering from an ulcer. All right. So it says the order is off. Whoa, hold on. Ooh, I think this is the one I always kept taking out. Yeah, y'all are right. All right. Don't yell at me. Hey. Don't yell at me. This is one that I didn't fix. So that's my bad. Y'all are correct. So the correct order is the order. It's just the way that it's laid out on there. All right. So it's just, that's different. So it would be, where is it at? So it would be D. It wouldn't be A. That would be the first one. All right. So shout out to y'all. We'll omit this one. We'll omit it. You know what I'm saying? We'll omit it, and that's okay. That's all right. We Gucci out here. Remember, when you guys take NCLEX, you're not going to get them all right either. You know what I'm saying? We keeping it real. Keeping it real funky up in here. All right, here we go. Question 15. The following clients are presented with signs and symptoms of heat-related illnesses. Which of them needs to be attended first? Which of them needs to be attended first? All right, now let's think about this. Now we're talking about heat-related injuries. Thinking about heat stroke, heat exhaustion, right? So is it A relatively healthy homemaker who reports that the air conditioner has broken for days and who manifests fatigue, hypotension, tachypnea, and profused sweating? Or is it an elderly person, right, who complains of dizziness and syncope after standing in the sun for several hours to view a parade? Shout out to the parade. Is it a homeless person who is a poor historian, has an altered mental status, poor muscle coordination, and hot, dry, ashen skin? That man ashy, right? Whose duration of heat exposure is unknown? Or is it a marathon runner who complains of several leg cramps and nausea and manifest weakness, pallor, diaphoresis, and tachycardia? What are we thinking? We got some D's, we got some C's. All right. Now you got to think about these things. How many of these are have negatively impact our patients, right? Think about them. Think about them. What does the patient represent? What does the patient, how does the patient represent to you? Kiki is screaming C. Ma'am, I see you out here. I see you. I see you. I see you. All right. What are we thinking? We got some C's. All right. So it looks like we're juggling between C and D. One person says A. Who said H? H ain't even an answer choice. What are we talking about? Heat exhaustion. Okay. All right. C. All right. Cool. A. All right. Here we go. Let's see what our answer is. Let us see what our answer is in 3, 2. It says if the runner is complaining, he's alert. I know that's right. Here we go. But the answer indeed is C. A homeless person who is a poor historian, has an altered mental status, poor muscle coordination, and hot, dry, ashen skin, and whose duration of heat exposure is unknown. The signs and symptoms manifested by the homeless person indicates that a heat stroke is happening, a medical emergency, which can lead to brain damage. Also, there must be clinical signs of central nervous system dysfunction that may include ataxia, delirium, or seizures in the setting of exposure to hot weather or strenuous physical exertion. Patients who present with heat strokes typically have vital sign abnormalities to include an elevated core body temperature, sinus tachycardia, tachypnea, a widened pulse pressure, and a quarter of the patients will have hypotension. All right, so C is the correct answer. Altered mental status, dry skin. Yep. That's telling me I'm having a perfusion issue and I don't have the natural way that I cool my body is gone. I can't do it. But the altered mental status, that is the big one. That the alternated level of consciousness is important. It's just as important as your ABCs because it tells you about your ABCs. Does it not? I'm just saying. So shout out to y'all for getting that question right. Ladies and gentlemen, hey, and if you're new here, I got some test taking tips you guys can go over there and check out. Hey, I had an ebook. It was 42 pages, and now I gave it to you for free. And I want you to go over there and check that out. You can check it out at thebootnurse.com/test. Go over there and get all that, get everything but the kitchen sink. And you don't get my fanny pack. I do recommend everybody get a fanny pack because who wants to be dropping shit all over the floor at the hospital? That's nasty. All right. You can put snacks in there. I'm pretty sure I have some Jolly Ranchers in there. Go get you some Jolly Ranchers. All right. But make sure you guys go get that download as well. All right. Thebootnurse.com/test for those tips to conquer the NCLEX. Wow. Free shit. I'm trying to tell you out here. Question 16. An anxious female. All right. Client complains of chest tightness, tingling sensations, and palpitations. Deep, rapid breathing and carpal spasms are noted. Which of the following action should the nurse do first? All right, so I think I have enough information in the stem of the question, right? So what do I want to do? What is the very first thing that I want to do? All right, what is the very first thing that I want to do? Provide oxygen therapy, notify the physician immediately, administer, anoxylytic medication as ordered, or have the patient breathe into a brown paper bag. Brown paper bag. It says D, to prevent respiratory alkalosis. Okay. Now what? Okay, well, we're not going to get into that. We'll talk about that. Always oxygen first. If it's an option, I swear to God, that's not all. That is not something, Marissa, I want you to live by. That is because it's not always oxygen. I'm not saying that this one's not always oxygen, but oxygen is not always the first answer. I'm trying to tell you. Carpal spasms are the key. Wonder Woman, let them know. This one is oxygen. Hey, first of all, I want you want to bet money on that? It says, why would you add oxygen if she's hyperventilating? Hey, Storm Gold. Some people don't know that. Some people don't know that. So we're about to find out. We finna find out. Okay. All right. D, 100%. Hey, I'm not knocking you. I'm not knocking you. Let's see what the answer is. Let's see what the answer is in 3, 2. And the answer indeed is D. It says, thank you for what you do. Marissa, listen, I love teaching people. All right. But I also want people to realize that not everybody is where you are. And we all got to learn here. All right. Storm Gold is like, hell yeah. That's what I'm talking about. All right. But we want to have the client breathe into a brown paper bag. Just like somebody said, hyperventilation. Where do you get a brown paper bag from? Probably at the nurse's station. It was in there. It was in the question, right? So the client is suffering from hyperventilation secondary to anxiety. All right. Secondary to anxiety. The initial action is to let the client breathe into a paper bag that will allow the rebreathing of carbon dioxide. Okay. The idea behind breathing into a paper bag or mask is that rebreathing exhalated air helps the body put CO2 back into the blood. All right. Back into the blood. All right. It says NCLEX's perfect world. Have it in your face. Exactly. It's perfect world. It's perfect world. All right. Connor Walsh is saying false. Listen, it doesn't matter if you think it's false or not. That's the answer. So, you can either take it or leave it. You can either take it or leave it. You do with that what you'd like to do, sir or ma'am, or whatever you identify as. Here we go. Question 17. An intoxicated client comes into the emergency department with uncooperative behavior, mild confusion, and slurred speech. The client is unable to provide a good history, but he verbalizes that he had been drinking a lot. Which of the following is a priority action of the nurse? So what do you want to do for this person who is inebriated in your emergency department? Number one, you better protect yourself. So don't be letting a motherfucker put hands on you like that. You know what I'm saying? So is it A, administer IV fluid, incorporate with vitamin B1 as ordered? Do I want to administer naloxone 4 milligrams? Contact the family to get information about the client, or obtain an order to determine and blood alcohol level. I'm ready for this weekend. That's what I'm talking about, Morgan. I'm ready for you to be ready for this weekend. Wait, what's this weekend? What are we doing? Morgan's telling me D. Okay. What are we thinking? Shout out to all 184 y'all. We're doing NCLEX questions. We are doing NCLEX questions. Somebody said to gather information. Do we need to gather more information if there's tons of information that's already been provided to us in our question? This is just a question that I'm asking. All right. Remember, if there is enough information in the stem of the question, you don't need to assess anything. All right. Remember, this is where we call what we do is called recognizing cues. For my people that have failed NCLEX, I'm pretty sure you see that category, right? Recognizing the cues, the vital signs, the signs and symptoms. All right. So let's see what the answer is. Here we go. In 3, 2, and the answer is A. All right. The answer is A. All right. Administer IV fluid incorporated with vitamin B1 as ordered. All right. So the client has symptoms of alcohol abuse. They said, hey, I've been drinking a little bit, right? And it says this is a risk for Wernicke's syndrome, which is caused by a deficiency in vitamin B1. So a thiamine deficiency, which is a deficiency in vitamin B1, is common in patients with alcohol dependence. Cognitive impairments may be an early consequence of thiamine deficiency. Wernicke's encephalopathy is underdiagnosed and undertreated. All right. Does that make sense? Let me know down in the comments. Hey, give me the 30,000 likes right now. Give me 30,000 likes right now. Make sure you guys like, share, you guys follow. I want to know who you are, where you're from, where you're at in your nursing journey. Even if you come into my chat and you tell me it's false, you know what I'm saying? Even if you come into the chat and you tell me that it's false, I want to know. I want to know. All right. So remember, if you didn't get this answer correct, read your rationales. Shout out to Hawaii. Mahalo. It says just download your free test taking strategies. Hey, Bria, let them know how it is. How often do you do these lives? Monday, Wednesday, Friday, 5:30. All right. I'm actually going to start to scale it back a little bit. I'm only probably going to start doing it twice a week. I got my ATT. I graduate in 7 days. Shout out to you, Heather. It said I have 1 more year to go. Bear with me. Hey, I got you. I'm going to be here. I'm here. It's not like you can't see me. All right. Like John Cena, but you can. You know what I'm saying? Question 18. The nurse is providing discharge. instructions to a woman who has been treated for contusions and bruises due to domestic violence? What is the priority intervention for this client? So when we talk about domestic violence, what is the primary solution for domestic violence? All right. This is a psychosocial integrity type of question, right? So with psychosocial integrity, what is the number one? It is safety. Safety. There you go, Goldstorm. Protect the patient. Patient safety. So is it arrange transportation to a safe house? Advise the client about contacting the police, make an appointment to follow up on the injuries, or make a referral to a counselor. What do we think? Shout out to all 150 of y'all. Hey, if you guys are just now joining and you guys are new here, my name is Kevin. I'm a registered nurse. I have my BSN if that really matters to you. Been a nurse for almost 4 years. I worked ICU, OR, and PACU. I was in the Navy for 16 years. Last 9 years of my naval career, I was a master instructor, and I failed the NCLEX 3 times, and I'm glad that you're here. I failed 3 times. I passed on the 4th. Yes, I went straight to the ICU right after that. Yes, I've worked in other departments. Guess what? These people don't care about what you got going on. Get that license, go out here, take care of these people, make this money, improve upon yourself. Go get that degree. Girl, go get that degree. You know what I'm saying? And an award-winning author. Amos. Hey, and I'm an award-winning author. Go check it out. Go pre-order, conquer it. Go pre-order it, all right? It says, hi, I'm graduating at the end of May. What would you recommend to study, Archer or UWorld? Either one of them are good for questions. Either one of them are good for questions. I also have an NCLEX review. You can check that out. That's linked in my bio. It's actually linked in my bio, and it's right there on the page. All right, so you can go over there and check that out for yourself. It says, B, woo, I'm a US RN now. hey, G, speak it into existence, and it will come to fruition. Keep putting in that work. All right, that was an NCLEX question. Yep, indeed it was. All right, safety is a priority for this client, and she should not return to a place where violence could occur. Make sure a safe environment is provided, offer shelter options, legal services, counseling, and facilitate such referrals. I finished nursing school in December. Does it make sense to invest in a reviewer now? Yeah, why not? Hey, if you get the review now, you have it forever. So, ancestors be willing, right? You can get it now, and if you need it in December, it'll be there. By the time you really start to use it in December, November timeframe, there's going to be more videos that are in there. Right now, I have 80 videos. I have 80 videos in there with 2 NCLEX reviews. All right, 2 NCLEX reviews. All right, here we go. Question number 19. In the work setting, what is the primary responsibility of the nurse in preparation for disaster management that includes natural disasters and bioterrorism incidences? All right. It says, thanks for doing this, Kevin. So helpful. Mango, you are welcome. This is what I do. Make sure you guys go over there and get that free download too. All right. So what is your responsibility when you prepare for disasters? All right. Be aware of the signs and symptoms of potential agents of bioterrorism. Make ethical decisions regarding exposing self to potentially illegal substances. Be aware of the agency's emergency response plan, or be aware of what and how to report to the Center for Disease Control and Prevention. What are we thinking? Hey, shout out to all 150 of y'all. I got these questions off of nurseslabs.com. Nurses, meaning more than one. Labs, also meaning more than one. .com, meaning the internet. So nurseslabs.com. These are free sets of questions. You guys can go over there and check them out for yourself. All right. Make sure you guys like, share, and you guys follow. Hey, I need 100 shares. I need 100 shares. I don't care if you don't like Becky with the good hair who's in your nursing program. I don't care. Like, I might like her. She might be cool. You know what I'm saying? I just need for y'all to share it. I might like Becky. Maybe she could, you know what I'm saying? Just share it out to people. Hey, y'all are in cahoots. That's an app. Y'all are in cahoots with one another. Share it to Cahoots and see who's going to be a part of that. You know what I'm saying? But the answer is C. Be aware of the agency's emergency response plan. In disaster preparedness, the nurse should know the emergency response plan. This gives guidance that includes the role of the team members, responsibilities, and mechanisms of reporting. Emergency preparedness encompasses diverse fields within the hospital and regional settings. Planning membership groups should address key aspects across these fields, including, but not limited to, public safety, facilities, logistics, pharmacy, transportation, clinical patient care, non-clinical patient care, media and public relations, communications, radiation, infection control, and administration. This is important for when you have what we call a mass casualty. I live in San Antonio. We've had a few of them for some acts of the T word where they like to pew pew in public places. And, you got to know who needs to go out, and that way you can prepare for people to come in. Okay. So that's part of it. And if you're ever curious, look at it for sure. Okay. So that's more all encompassing. Exactly. All right. So shout out to y'all. Here we go. Question number 20. Question number 20. Y'all keep sharing. We need 100 shares out here. We need 100 shares. All right. Michael works as a triage nurse and 4 clients arrive at the same time. All right. List the order in which he will assess these clients from first to last. So who are we going to see first? Is it going to be the ambulatory, dazed 25-year-old with a bandage to the head wound? Is it going to be a 50-year-old with moderate abdominal pain and occasional vomiting? A 35-year-old jogger with a twisted ankle having a pulse and no deformities? Or is it going to be an irritable infant with a fever, petechiae, and nuchal rigidity? Who are we seeing first? A, D, B, and C. All right, Anna. However close to meeting Jesus first. Wow. Will. I mean, you're not wrong. You're not wrong. You're not wrong. Infant first. Okay. You got to put them in order. Hopefully I corrected this one. I think I did. So who are we going to see first? Who are we going to see second? Who are we going to see third? And who are we going to see fourth? Bria is saying, okay, A. So A. Okay. All right. Heather is telling me DBAC, 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 DABC. Whoop, whoop. All right, here we go. Let's see. Let's see what our answer is, y'all. It says, no, the 25 first because of the head trauma. And all right, let's read that again. We're going to read it again. Read the answer. RTFA, an ambulatory dazed 25-year-old with a bandaged head wound. Think about it. Hey, look. Hey, Hey, stop playing games with me. Stop playing games with me. All right, let's see. See what the answer is. In 3, 2. There it is. D, A, C, and B. Now, an irritable infant with a petechiae who has a nuchal rigidity has meningeal signs. So meningitis is a life-threatening disorder. So apparently, some of y'all don't like babies. Y'all don't like babies? Y'all are just like, yeah, let me go to the head wound. Oh my God, but I got this infant that got meningitis and could die. But, whatever. We'll make another one. But we'll just take care of this guy who's walking with head stuff. Whatever. So, that individual would be second. That individual would be second. All right. Because it could say that he has intracranial pressure, hence why he does have a daze. Right. But this patient right now is definitely telling us that they have the nuchal rigidity, which is part of meningitis. All right. Now, the patient with abdominal pain is uncomfortable, but not stable at this point. An acute condition could determine, where was I at? Could determine urgent attention and treatment. Hold on a second. TikTok always wants me to do this stupid puzzle. Like, it's like Netflix. Are you still watching? Bitch, I'm still watching. What are we talking about? Anyway, so here we go. There's y'all's answer. Hey. Meningitis. Remember, the key word was ambulatory. Hey, who are you going to see first? All right. So shout out to y'all for getting it right. Hey, once again, ladies and gentlemen, once again, go over there, get you some test taking tips. All right. If you have not gotten it or if you missed it, hey, that's 42 pages. That was my ebook that I was like, you know what? I'm just going to give it away for free. And I gave it away for free. And now y'all can go over there and y'all can get it. It's 42 pages minus that fanny pack. Go get a fanny pack. Stop playing games with me. Put some Jolly Ranchers in it. Don't share it with nobody else. You know what I'm saying? Those are your Jolly Ranchers. But anyways, go over there and get it free. Download thebootnurse.com/test. All right. Woohoo, free. It says, God bless for sharing. Look, this is what I do. All right, here we go. Question number 21. In conducting a primary survey on a trauma patient, which of the following is considered one of the priority elements in a primary survey? So what is a priority? What is important when it comes to doing a primary, which is your first survey? What is important? You have to know these words. You have to know, live, and understand these words. Shout out to all 130 of y'all out here rocking. We're doing NCLEX questions. I got them off nurseslabs.com. They are free sets of questions. Go over there and check them out. I want to know who you are, where you're from, where you're at in your nursing journey. All right. And if you're not a nurse, what are you doing here rocking with me? If you want to be a nurse, trust and believe me. Come and be a part of the crew. Come and be a part of the crew. AKA, that doesn't mean go buy your stuff and try to become a nurse. That means go do it like the rest of us, because we don't like people that cheat their way through. You know what I'm saying? So here we go. This chick is bad to the bone. It's saying D. Okay. Let's see what the answer is, y'all. Let's see what the answer is in 3, 2. And the answer is A. It's a brief neurological assessment, all right? The brief neurological assessment to determine the level of consciousness and pupil reaction is part of the primary survey. Once the patient is stabilized, a neurological examination should be conducted. CT scan is the diagnostic modality of choice in the initial evaluation of patients with head trauma. I'm not even a nurse yet. I'm getting all these right. Cool. Go to nursing school. Go to nursing school and come be a part of it. All right. You can come be a part of it. And it's all in fun. All right. But it's like you're getting them all right. But do you understand the true why? Oops, I got that wrong. That's okay. Is it Shaleficent? I see what you did there. But hey, we got to remember. So as we're answering these questions, you got to understand, and you have to understand truly why. You got to recognize those cues. You know, like you could be a doctor. You know, this could be something that'd be a little bit below the level of knowledge that, you know, you would need to know. But this is right up there with the knowledge where everybody else needs to know. Right. So here we go. A 65-year-old patient arrived at the triage area with complaints of diaphoresis, dizziness, and left-sided chest pain. All right. This patient should be prioritized into which category? All right. Non-urgent, urgent, emergent, or high urgent. Which one? Which one are we thinking? Shout out to y'all for rocking with me. We are doing NCLEX questions. I got them off nurseslabs.com. They are free sets of questions. Make sure you guys go over there and check them out for yourself. All right. Like I said, I want to know who you are, where you're from, and where you're at in your nursing journey. Y'all got me to 100 shares. I love it. All right, let us see. Let us see what the answer is. Here's our answer in 3, 2, and the answer is C. It is emergent. Shout out to Ghana. All right. So chest pain is considered an emergent priority, which is defined as potentially life-threatening. If the nurse can accurately diagnose the patient with these criteria and marked as level 1 trauma patient, the patient will need immediate life-saving therapy. Immediate physician involvement in the care of the patient is crucial and is one of the differences between level 1 and level 2 patient designations. All right. The highest urgency would be emergent, as in life, limb, eyesight, life-saving things that need to be taken care of with this patient. All right. So shout out to everybody for getting this question right. Circle back if you don't understand how to triage a patient. Remember, triage means to sort in French. All right. So who requires my attention? Life-threatening conditions, life, limb, eyesight, massive hemorrhage, no pulses, so on and so forth. All right. So shout out to y'all. Here we go. Question number 23. You respond to a call for help from the ED waiting room. There is an elderly patient lying on the floor. All right. List the order for the actions that you would perform. All right. So instructing a nursing assistant to get the emergency cart, establish unresponsiveness, perform the chin lift or jaw thrust maneuver, call for help and activate the code team, and or when to initiate CPR. When to initiate CPR. What are we thinking? What are we thinking? And yes, you're going to use every single one of them. Man, I think I put this one. Man, I hope this one's in the right order. I feel like I fluffed this one up too, but that's okay. That's okay. A or E is number 1. Think about it. What's the very first thing I want to do? And then what will be number 2? And then what will be number 3? E is first. So, okay. So you run up on an elderly patient who's on the floor. What if they're face down on the floor? Call for help. Okay. A. Okay. All right. Hey, Storm Gold. Hey, Storm Gold, can you hear me? Hey, Storm Gold, can you hear me? Oh. Okay. Oh, you can hear me? Okay, cool. So you weren't unresponsive, huh? Oh, I guess that makes sense. Y'all see what I did there? Do y'all see what I did there? Oh, that's what I'm talking about. Let's see what the answer is. So this is wrong, by the way. This is wrong. Because A is not that, right? A is not that. So it's definitely B. We want to establish unresponsiveness first. I need to know. Storm Gold, are you okay? Can you hear me? No? Oh, hell, I guess Storm Gold can't hear me. Storm Gold can't hear me. Hey, I need help. You call the code blue, right? And then so on and so forth, right? There you go. You have to establish responsiveness first, right? I can't just be like, oh, you're down on the ground. Let me just start pushing on your chest. Remember, they're elderly, right? You start punching on Mima's chest, it's not gonna be a good day for her. You see what I'm saying? So make sure we understand. Make sure we understand that. All right. Make sure we understand that. I feel like this is out of order. I don't feel like reading it, but make sure establish responsiveness first. OK, you have to. If you get questions like this, you got to establish responsiveness first. All right. So here we go. Question number 24. In caring for a victim of SA, not going to say it because if I say it, I'm going to get blocked and I don't like that. You know, TikTok be acting up. You know what I'm saying? Which task is most appropriate to the LPN? Yep, chest taps and talk to them. Or what is it? Verbal or and then onto painful stimuli, right? Sternal rub, right? The nail beds, right? Shaking of the shoulders, right? So is it A, provide emotional support and supportive communication, assess immediate emotional state and physical injuries, ensure that the chain of custody is maintained, or collect hair samples, saliva swabs, and scraping beneath fingernails. What are we thinking? Man, I feel like I should take this. I'm just going to do this because literally if TikTok, they're going to be like, wait, what is that? They literally will start shadow banning me. It's wild. I'm like, really, bro? Here we go. D and A. Okay. A, D. Got it. So let's think about it. What's appropriate, right? What can the LPN do? What is the LPN scope of practice? I think I got a question like this wrong once about therapeutic communication being RN. Okay. All right. Well, let's see. What is the most appropriate task that the LVN or LPN can do? It says D is like an assessment. Yeah. LPN, RN, police, MD. Okay. Well, let's see what the answer is. Here we go. In 3, 2. The answer is A. The answer is A. Provide emotional support and supportive communication. All right. The LVN is able to listen and provide emotional support for her patient. The client is the center of care, right? The client is the center of care. All right. Someone says D should be performed by yes, they should. Glad I'm here for the clarification, right? So that was a therapeutic communication type of question, right? So that is your, Amos, that is your clarification aspect right there, okay? So remember, if you got it wrong, circle back. If you got it wrong, as a matter of fact, read your rationales. Read the rationales to help solidify what you are trying to learn, all right? So shout out to y'all for getting it right. And if you got it wrong, circle back. That's okay. It's okay for you to get it wrong here. It says, I love this concept. It was fun. Thank you. Sir, I followed you. I look forward to more. Storm Gold, I'm glad. I can't wait to see you on the next one, all right? Here we go. Question number 25. Following an emergency endotracheal intubation, nurses should verify tube placement and secure the tube. Wait a minute. I don't even like this question because I remember that this question was mixed up and I didn't like it. So I'm going to give you another question. So we're just going to do that question. We're gonna go to that question because there's something that's wrong with it. Hold on. It says, "Hey Kev, I passed my NCLEX. Not sure if you remember me telling you. I don't remember you telling me, and I remember, and now I know." So Anthony, congratulations, good sir. Hey, all 115 of y'all, I need y'all to congratulate Anthony right now. Congratulate Anthony right now. Drop likes for him. Do it all. Drop gifts. Do whatever. Anthony, congratulations. Welcome to the greatest shit show on earth, my good sir, known as being a nurse. If there's a piece of advice that you could give out to everybody out here, sir, what would it be? And once again, congratulations to you. Let everybody know who helped you. Wink, wink. Kevin. Question number 26, a 15-year-old client arrives to the emergency department. He is conscious, coherent, and ambulatory, but his shirt and pants are torn with blood. He and his hysterical friends are yelling and trying to explain that they were goofing around, and he got poked in the abdomen with a stick, which of the following comments should be given first consideration. All right, so what should be given first? The stick was really dirty and covered with mud. He pulled the stick out just now because it was hurting him. He's a diabetic, so he needs attention right now. Or there was a lot of blood, and we used 3 bandages. Everybody's telling me B. This question's kind of been on here for a second, so everybody's telling me B. All right. Mama Anthony got all the love, all the attention. Let them know, Anthony. Let them know how you did it. All right. And let these people know to never give up. All right. Never give up, ever. Get off that beach. All right, let's see what the answer is. Let us see what the answer is. Y'all see what I did there? Let us see what the answer is. It doesn't matter. Here we go. And the answer is B. He pulled the stick out just now because it was hurting him. An impaled object may be providing a tamponade effect, and removing can precipitate sudden hemodynamic decomposition. All right, additional history, including a more definitive description of the blood loss. Depth of penetration and medical history should be obtained. Surgery is often required. Impaled objects are secured in place so that they do not move, and they should only be removed in the operating room. All right. In the operating room. Hold on. It says, stay calm. Listen to Nurse Kev. He knows it. Hey, that's what I'm talking about, man. Hey, that makes me, listen, what makes me happy as an instructor is to see people come back to tell me that. All right. So Anthony, I really appreciate that. I'm glad that that worked out for you, my guy. I really am. And now you're going to go out there and do awesome. So super proud of you. Super proud of you. All right. So that is what it is. That answer choice is B. All right. That answer choice is B. Lastly, ladies and gentlemen, of course, I got those test taking tips that are over there that you guys can go and get to conquer the NCLEX. It was one of my ebooks. Now it's a free book for y'all to go over there and take. Hey, I'm letting y'all know it's going away. It's going away at some point. I don't know when, but it could be today. It could be tomorrow. It could be, I don't know, a month from now, whatever. Make sure you go over there and get it. The test taking tips to help you conquer the NCLEX from somebody who is an award-winning author. Go get it. It's free download. All right. thebootnurse.com/test. Go over there and get you that knowledge. Go get you that knowledge. All right. But of course, ladies and gentlemen, that is a wrap today here on this Friday. All right. Kept it right around an hour, maybe a little bit more. All right. It was a wrap. I appreciate y'all for hanging out. I love all the likes, all the love. While the gifts are not mandatory by any means, they are surely appreciated. So I appreciate everybody that came by. If you got banned, which nobody did, but if you do get banned ever, it's because you deserve it, and I'm petty, and I'm letting you know. Once again, I got these questions off nurseslabs.com, free sets of questions. You guys can go over there and check them out for yourself. 7-day NCLEX course, which is my course, my baby. $97, you get it for a lifetime. Go over there and check it out. It's linked in my bio. All right. You get it for a lifetime. All right. And I have 80 videos over there on top of, I'm working on about another 50 videos that are going to be going there as well. All right. And if you need one-on-one coaching, or if you want an ebook, go check out my link tree. I do one-on-one coaching. I actually just posted one for a young lady that I've coached for the month of April, and she just passed on her 4th attempt. She can do it. Y'all can do it. All right. Now I'm going to do Ask Me Anything. Turn the camera around. So if you guys got any questions about nursing, about whatever, you know what I'm saying, just ask me. Just ask me. You know what I'm saying? So what's up, y'all? How y'all doing? My name's Kevin. I go by The Boot Nurse on all those social media platforms. I've been a nurse for, like I said, almost 4 years. I was in the Navy. I worked ICU, OR, and PACU. I'm an award-winning author. My book is coming out in June. So make sure you guys go over there and cop that. Check the link in the description. I failed my NCLEX 3 times. I don't know what else you want me to tell you. I failed my NCLEX 3 times. So what I'm going to tell you is to get out of your own way. Get out of your own way. You know what I'm saying? Find out why you didn't do so well on the NCLEX. Or if you're studying for NCLEX, find out those areas that you're not doing so well in, and that's where you focus at first. So if pharmacology is it, that's where you start. Start with the hard section first and keep it pushing, all right? My job has never asked me, ever, if I ever failed the NCLEX. My patient never asked me if I failed the NCLEX. They don't care. As long as you are competent and you're safe and you're out here doing your thing, all right? I'm from the Bahamas. What's the best route to take for me to take the NCLEX? Brown sugar, ma'am. So what you need to do is that you need to send all of your paperwork through credentialing. I think it's the national credentialing group. I don't know the exact website off the top of my head. And then they verify your stuff from the Bahamas. And then they will tell you, and then you can register in a specific state. I would recommend like New York or somewhere where they have or Ohio or something like that. If they allow for you to do that. And then they'll send you all the paperwork so you can take everything that you need. Sir Kev, shout out to the Philippines. Hey, G, shout out to the Philippines. Hey, I'm trying to go to the Philippines on like a vacation. I need somebody to like put me up. Like Nepal. I want to go to Nepal because I have some people from Nepal up in here. You know what I'm saying? From Fiji. You know what I'm saying? I'll be a globe-trotting NCLEX coach. You know what I'm saying? I'll do it. So what questions do you guys have? What questions do you guys have about NCLEX? Do you have about nursing? I'm going to hang out for maybe a couple of minutes to see what questions you guys have. Congratulations to everybody that graduated or that is going to graduate. It's a huge, huge milestone for you. It's a huge, huge milestone for you to get that nursing degree. It doesn't matter which one it is. It doesn't matter if you got that diploma as an LPN. It doesn't matter if you get that ADN and as a 2-year nurse. It doesn't matter if you get that BSN, as long as you out here doing your thing and keep your progression going. Sassy Spoon says, I graduated today. Shout out to you, ma'am. Congratulations. Hey, I'm telling y'all, nursing school, way harder than the NCLEX. Why? You had to do the prereqs to get into school, then get into school, or the prereqs to get into school, then the entrance exam, then to get into school, and go through all the nonsense of school, the endurance, and then graduate. It took you years to do that, to prepare you to take a 5-hour exam or a maximum of a 5-hour exam. You know what I'm saying? So just saying, it works. Like, don't stop before you pass the finish line. All right. Don't stop before you pass the finish line. I'm a first generation college grad. Shout out to you. Amos, it always has to be about you, huh? I'm a first generation this. My daddy bought me a car. I like this. Man, it ain't always about you. God. No, I'm just playing. Congratulations to you, though. First generation, that's a big deal. Yes, wow. Oh, okay. So, no, but that's good. Hey, for real though, like that's a big accomplishment. Is because now that you're first generation, now you're about to set the bar high for other people following behind you. If you have kids, siblings, whomever, all right. First generation and honors grad, shout out to you. That's what I'm saying. You guys are setting the bar for individuals in your lineage to come up after you. You know what I'm saying? So, hey, set that bar. Let them know that you can achieve these things. Education, monetary things, all that stuff. You can achieve it. So shout out to all 54 of y'all. What questions? Y'all got me to 30,000 likes, 32. Y'all got me 100 shares. I appreciate y'all. I guess y'all ain't so greedy out here on this Friday. But what questions do you guys have for me? What other questions do you guys have for me? What other questions you guys have? Like I said, I'm going to hang out for a couple minutes. Today is Friday. We got things to do out here. We got things to do. We got things to do. A lot of people always ask me study tips for nursing school. So what I would recommend is one big one is Khan Academy and Registered Nurse RN on YouTube. Huge. Registered Nurse Sarah, Registered Nurse RN on YouTube. Huge for nursing school, in my opinion. There's a whole bunch of other ones that are out there, but she's the one that sticks out to me the most. Were you ever discouraged after the first or second failure? I was. No, I was mostly discouraged. I got really discouraged after the third one. I did, because I felt I was the most prepared for that one, but I really wasn't, because I had a very mediocre level of questions. I got to 105 or 106 questions, something like that. And then when I failed, I was like, damn, okay, now what am I doing that's wrong? And so I really had to dig deep And it actually took a mentor to tell me, hey, you're doing this wrong and you need to fix it. And I'm like, all right, cool. And within like a whole hour of talking to this guy, he got me right. And so then I had to restructure. It wasn't even all necessarily about the content. It was about my whole overall aspect of tackling this exam. So from the way that I even studied to all the knowledge that I was acquiring all over the place. So I wasn't discouraged after that. I wasn't discouraged after my first or second, but I was definitely discouraged after my third. After my first one, I was like, whatever. My second one, I had 265 questions, and I was about to have a panic. I had a panic attack. That's how terrible that one was. And then, like I said, after the third one, I felt like, maybe I don't belong here. But then, I had somebody who wrote me in to let me know that, hey, we can still do this. So, like I said, I felt the same exact way that everybody has felt, whether it's your first time or multiple times. I've been there. I have been there. It says, thank you. You are my English and NCLEX teacher. You're welcome. Is it, oh my God, Mabelita. There it is, Mabelita. Hey, hopefully I'm teaching you good English, but I'll definitely teach you NCLEX for sure. Fuzzy Peach says, it's been 4 years since I took my prereqs for nursing. How do I study for the T's? Future RN prep here on YouTube. Future RN prep on YouTube for you, Fuzzy Peach, to study for the T's. I want to start the nursing program in September. Then what's stopping you? What's stopping you from joining that program? So confidence made a big difference. Absolutely. You got to think, is like, no one's taking this test but you. No one is taking this test but you. So what are you going to do? You going to get out of your own way, or are you going to yeehaw, right? Of course, come here with the mustache. Ma'am, thank you. I appreciate you, Miss G. So you have to have the confidence. I can't want you to have a license more than you want to have a license. I can be as confident. I can give you all the motivation, all in the world. But if you aren't willing to put in the work, and if you don't believe in what you are doing, you won't have anything. Does that make sense? I'm here getting ready for a weekend of clinicals on a peds floor. Shelby, go love those babies. Hey, be a nurse's nurse, as one of the homies, Nurse Larissa says, be a nurse's nurse. Go over there, be hands-on, just like you're in peds, so you've been in clinicals for quite some time. Go be hands-on. Now with babies, I know what it'll do to you. Especially if you go to the newborn nursery or anything like that. But you have to be a nurse's nurse. You have to get in there. You have to ask questions. You have to participate. That's the only way that you're going to get better at when it comes to doing hands-on stuff. I promise you. Fuzzy Peach says, bet. Taking NCLEX for the second time. You're very helpful, and I feel more confident. Bria, here's the thing. I'm going to show you. Look at these. Y'all see these? Hey, these are my NCLEX. These are 2 of 3 of my NCLEX breakdowns. When you fail your NCLEX, you get data. You get data right here. This is data telling you where you suck. Sorry. Guess what? I sucked in management of care. I sucked in safety and infection control. I sucked in health promotions and maintenance, psychosocial integrity. This was my very first one. It was terrible, y'all. It was terrible. So my question is to you, with this data, where are you going to start first? Probably at the one where you suck the most. It wouldn't be at an above standard, would it? Right? So you have to use this correctly. And it tells you the areas. It tells you the areas of where they are. All right? It tells you those areas. So you have to go forth and you have to push with that. What should we do for the day before the test? Amos, nothing. You should do absolutely nothing. Meaning, don't be on TikTok. Or not saying be on TikTok. Don't study anything NCLEX related. Don't do any of that nonsense. You need to be sitting and relaxing. I know that is better said than done. However, by you not doing those things, you are controlling your ambiance. If that makes sense, you're controlling everything that you got going on, right? Go to a place of zen. A place of zen, a place of peace for yourself mentally. Is that to the gym? Is that like going for a walk, doing those things to get rid of the friction and the anxiety and the nervousness. At any point in time, hey, this is for 46 of y'all, at any point in time, and one of my moms told me this, anytime you're feeling stressed, take a deep breath, close your eyes, and then push it through your feet. Like Push it. Like, I know this is going to sound crazy, but push it through your feet and then watch how you feel it start to leave your body. All right. But you have to want this. You have to want for that to happen. All right. You have to want for that to happen. I do have one question. Do you think I should take the NCLEX right after graduation or wait and study? Shelby, you should take it ASAP. You should take it as soon as you possibly can. Why? Because you're coming right out of school where all that knowledge is still fresh up here. The longer you are out of school, the more information that starts to leave you. All right. So take it ASAP. Who is that? Is it Haley? Did I say that right? Haley. I failed twice and I don't know where to start again. Haley, I don't know if you just joined, but the very first thing that you need to do is that you need to get that performance breakdown where it shows you that you didn't do well on. The area, the section that you didn't do well on. So like right here, it says management of care. Yeah, I know it's backwards. I don't care, right? You start there where it's below. And guess what? On your breakdown, it will tell you what areas of management of care, like advanced directives, advocacy, assignment, delegation, supervision, case management, client rights, establishing priority. That's where you start first. That's where you start first. And also, anybody that needs an NCLEX course, I actually have an NCLEX course. You can check it. That link is in my bio. It has 80 questions, right? 2 NCLEX reviews, one for the 8 client needs sections, and then the other one is just I put together random questions, 100 of them, and then we talk about cases or things to work in at the end of it. All right. So you get, and hey, right now it's 70% off, right? $97, you guys, and it's yours for a lifetime. Go over there and check it out. All right. I passed my comprehensive predictor in my nursing final on Monday. Last hurdle is graduation. Ashley, hey, graduation, NCLEX, one at a time. I will absolutely try that. Amos, you definitely should try that for sure. Thank you. And thank you, Heather. You guys are very welcome. This is what I like to talk about when we talk about building that community with one another. All right. So any other questions? What other questions do you guys have out here? Shout out to all 39 of y'all. Hey, we did NCLEX questions off of nurseslabs.com. Free sets of questions. All right. They're free sets of questions. You got to go over there and check them out for yourself. Like I said, I got an ebook. I'm an award-winning author. So I have a published book that's going to be coming out next month on the 5th. And the 5th of June is my 4-year anniversary. So it only makes sense that it comes out on my 4-year anniversary, right? And my book is called Conquer It. Conquer It, the journey to passing the NCLEX. Because the path to conquering NCLEX begins with you, all right? And it began with me. So I want you to indulge in that story and realize that you can achieve anything when you really put your mind to it and you readjust based off of your unsuccessful things that have or your failures that have happened in the past. Okay. So what other questions do you guys have? I know I got 30 folks up in here. If you are new here jumping in and you're a nursing student or you're taking NCLEX or whatever, I want to know who you are, where you're from, where you're at in your nursing journey. I'm an RN, a BSN if you really care. And I live in Texas. So shout out to all my folks that live in Texas. You know what I'm saying? I've worked ICU, OR, and PACU. Specifically, I worked in a medical ICU and a burn ICU. And like I said, I've worked in the recovery room or PACU, and I've worked as an OR nurse. So Caribbean, oh my God, Caribbean, St. Lucia. I know one other person that was from St. Lucia. So that's actually a vacation spot that I'm trying to go to pretty much throughout all of the Caribbean. So shout out to you. Shout out to you. Is it Nelson Dial? Shout out to you. Kevin, you play too much. What do you mean? What'd I do? I didn't even do nothing. I'm just here living my life. It says interested in doing this exam. Okay. So if you're interested, well, we need a little bit more context of that. Listen, I don't even know. I don't know what happened. I don't know why I said it that way. I'm tired. So I need a coach. All right. So, if you're looking for a coach for the NCLEX to take the NCLEX here in the United States, I do NCLEX coaching one-on-one. You can check that out. The link is in my bio. So you tap my face up here. And then when my gorgeous face types down here, you tap that. It'll take you to my main page. Go to my link tree. And it'll say, and you'll see all that stuff that's laid out right there. Okay. So what other questions do you guys have? I got 30 of y'all up in here. Ain't nobody got no questions besides Amos, famous Amos, who out here harassing me. My God, my goodness. What else are we thinking? What other questions do you guys have? If you guys don't have no other questions, you already know what I'm finna do. All right. Yeah, girl, I see you. I see you out here. I see you. All right. All right, cool. Well, looks like there aren't no other questions out here. So, since there are no other questions, I will leave y'all to it. Hey, first of all, I'm going to say this again. Congratulations to everybody that graduated, and congratulations to everybody who is going to be graduating over the weekend. All right. Super proud of y'all. The journey is not over. It's there. It's there. All right. You're almost through the finish line of this part of your journey. So don't stop. Don't stop running. Keep push all the way through the finish line. All right. If you need any type of guidance when it comes to NCLEX, you can check out my link tree on my main page. Where I go through, I have that free download, my ebook you can pre-order. My book you can pre-order, my ebook you can buy, as well as I have a course that you get for a lifetime for $97. You guys can go over there and check that out. As well, if you need coaching, you can check that out as well. And lastly, I'm going to take this one from one of my constituents, but do something nice for somebody this weekend. Do something nice. It could be anything. It could be picking up their trash. Y'all like to go to Starbucks, pay for the person behind you. You know what I'm saying? Look, Starbies, right? Pay for somebody's Starbies, I guess. I don't frequent Starbucks like that, but you know what I'm saying? Amos does, you know what I'm saying? You know what I'm saying? But hey, do something nice for somebody. All right. And then the next thing is it takes nothing for you to be kind to somebody, and always take care of yourself. All right. Take care of yourself mentally, spiritually, and physically, because if you can't take care of yourself, you cannot take care of no one else, not no spouse, not no damn kids, not no patients, not nothing. All right. You have to take care of you, or you are no good to no one else. All right. So that's my 2 cents. I want everybody to have a really good and safe weekend. It says, thank you. Enjoyed your live. Definitely motivated and made me feel a little bit more confident. Look, Heather, if you really want me to motivate you, I can get real Navy real quick, give you a few knife hands, make you cry a little bit, but in a motivational, no, I'm just playing. But you got this. You got this, most definitely. All right. So sometimes it takes somebody who has been down the road that we are trying to go to literally pick us up by the back of our shirts and tell us to get up and keep going. Sometimes it takes that. So a lot of time, I don't coddle. Sometimes I don't coddle. Well, I will tell you to get it up. I will be like, get up and let's go. Come on. We're going to do it together. Let's go. Get up. I don't let people quit, and I don't like quitters around me. If you're quitting, it's just like saying, oh my God, I can't believe how hard this is. I'm never going to make it. That's like negativity, and I don't want you nowhere near me. Get away. Go away. Go that way. Not near me. Yes. Thank you. I love your lives. I appreciate it, Shelby. All right. So like I said, get up. Stop feeling bad for yourself. Stop feeling sorry for yourself. And guess what? No one else does. No one else does. All right. Oh, by the way, hey, anybody ever need a mentor? Everybody ever need a mentor? I'm your mentor, just like my mentor and my other mom who that's where I got the idea where you push all of it through your feet. SSH mentoring, right? That's Sarah. She's like my other mom. I love her so much. Sarah, thank you so much. And she is also an award-winning author, right? And she's the reason why I am an award-winning author. So if anybody's ever interested in entrepreneurship, running a business or anything, check her out, SSH Mentoring. She's a wonderful soul. Wonderful soul. Make sure you guys go over there and check her out. I passed my pharmacology class now, med surg and mental health. Maternity. Shout out to you, Pink British. Wait, are you British? Are you British? Are you British? Right? No, but shout out to you. Yes, and your book is amazing. I love it. I'm glad that you like it. I can't wait for everyone else to read it as well. So, no, you're not British? Damn. Snap. But anyways, like I said, take care of yourself. Make sure you go follow Sarah. She's wonderful. All right. And make sure, like I said, you guys take care of yourself. If you guys need me, y'all know where to find me. Thank you. I love you, Sarah. Appreciate it. But until then, ladies and gentlemen, I will see each and every one of you guys back here on Monday. Y'all have a safe weekend. And if you graduate, hey,